Dr. Velarde, do you want to say anything? Dr. Velarde is our host for the series. She's the one who had, come up with this idea, our brainchild. And so I
just wanted to, I didn't expect the weather to throw us for a loop today, but those are the things that happen. So I think that we are definitely in for a treat. I don't know, I want them to give their own credentials instead of me regurgitating the little that I can, and it's very informal. Usually what we would like from the audience is to participate as much as possible and ask questions. I know I have a ton of questions about my skin because I don't take care of it. But just make me feel younger. Make me feel like I don't sleep, that I sleep like 8 hours, which I don't.
That could be part of the problem.
So thank you very much for coming. Thank you so much.
And feel free to sit if you are tired and don't want to stand. That's perfectly acceptable.
I think we'll stand in the beginning, and then if discussion just kind of lends itself to more casual, then we'll have to
You know what? You're forgiven. You have a reader.
I tell you what, it's not comfortable sitting or standing. He feels gigantic.
I'm sure.
All right. Well, thank you for that very nice introduction, Kathy and Dr. Velarde. Like she said, this is Megan, my physician's assistant. And what we're going to be talking about today is basically how to take care of your skin. Like Dr. Velarde said, this is not a formal discussion. So if you have a question, just raise your hand. You don't have to keep your question until the very end. I think it's a little bit more informative when we're talking about the topic for you to ask your question right on this spot than have to hold it in your brain until the very end. Okay? I trained at the University of Missouri. I did my undergrad medical school and residency there, where I majored in biochemistry, and then I did my medical school, and then I did my dermatology residency there. I moved to Jacksonville because my husband works for the Mayo Clinic, and I came down with him as a package deal. And I'll let Megan introduce herself and her credentials.
Yep, and I'm Megan. I'm a PA. I went to a small liberal arts school up in Pennsylvania, King's College, and that's where I'm from. I just relocated to Jacksonville in October. So dermatology in Florida is new to me, but working with Dr. Carson has been great. And so I'm excited to talk to you guys tonight too.
And in case you didn't know, dermatology is one of the hardest specialties to get into. Very competitive. So you have to be very brainy to do dermatology. And not only brainy, you're smart because you don't want to work as hard as cardiologists. So, but it's a very, very competitive specialty, and so.
Well, thank you, Dr. Velarde. I think I got lucky. I don't know if I could match into it again. It gets more and more competitive every year, but I feel blessed to do what I do, and so I want to share some of my knowledge with you. Okay. So the title of our presentation is Skin Cancer. That's really what we're going to focus on. That's kind of our bread and butter in our practice. It's what makes us tick, and it's what we've kind of focused our careers on. We'll talk a little bit about cosmetics and things that you can do to kind of help better your skin, but really what we're after today is skin cancer prevention and detection. And so the topic overview is kind of in 3 parts. We can't really understand skin cancer unless we talk about ultraviolet radiation and tanning. So we're going to go all the way back to high school or undergrad and learn about the UV spectrum and get a little bit basic science-y, not too much, but a little bit. Then we're going to jump right into skin cancer, and you're going to see pictures of basal cell, squamous cell, and melanoma. Most of the pictures are pretty banal. There is one that has a blue sheet over it, or a blue sort of covering that if you're squeamish at all, you probably want to divert your eyes when the blue thing falls down because it is a surgical picture. And then we're going to end on sun protection. So going all the way back to undergrad or high school, you have to understand ultraviolet radiation to understand skin cancer. We know that ultraviolet radiation is the #1 cause of skin cancer for basal cell, squamous cell, and melanoma. #1, not debatable. It is in the literature. It is fact. And so if you remember, there is the visible light, which is the Roy G. Biv, like the red, orange, yellow, green, blue, indigo, violet. And then right on top of that is the UVA and the UVB spectrum. And it's UVA and UVB which can penetrate our skin and cause skin cancer. How does it do that? It actually causes DNA mutations. so that there's an abnormal DNA pattern in those skin cells. And then if that gets perpetuated over and over with cell replication, then you end up with a skin cancer. Okay? So ultraviolet radiation in a nutshell is an invisible form of energy. You don't see it radiating from the sun or see it radiating from tanning beds, but it is there. It's not part of the visible spectrum, so it doesn't come into our eyes as a color or an image, but it is there. It is emitted by the sun and by artificial light, such as tanning beds, and UVA and UVB are the big players in skin cancer. UVA and UVB act a little bit differently on the skin. So in this diagram, the epidermis, which is the top layer of skin, is what primarily absorbs the UVB. And we remember B for burn. That's the ultraviolet radiation that causes a sunburn. UVA penetrates deeper. It goes down into the dermis. It does not cause a burn, however, but it will cause aging. So we remember B for burn and A for aging. Both contribute to skin cancer, however. Okay, over time, ultraviolet radiation will cause wrinkles, liver spots, which are kind of like the brown sunspots that you get on the backs of the hands or on your cheeks. It'll cause some sallowness, which is a little more of like a yellow discoloration to the skin, patchy hyperpigmentation, and then obviously the big one, skin cancer. So now it's your time to participate. This is a quiz. Can anybody explain this photo? This is the exact same woman. We're just looking at the right and left sides of her face, and these photos were taken on the exact same day.
From driving?
It's a very good thought. It's pretty close. Oh, sorry, I keep doing that. I'm really sorry. So in this photo, this is, I cannot, okay. Okay. No, I didn't touch the thing. Okay, maybe I should do it like this. I'm going to do it like this, okay? In this photo, this woman had lived and worked at the same desk for 2 decades, and this was the side of her face facing her window. She never moved her desk. This was the side of her face that was shaded, okay? She did not go home from work every day with a sunburn on her face because those B rays that I told you about, they don't go through glass. The A rays go through glass and they penetrate deeper. So she never went home with a sunburn, but as the decades went by, this side of her face got sallow, wrinkled, patchy hyperpigmentation. The shaded side did not. Okay? So skin cancer, it's a growing problem. 1 in 5 Americans will develop some form of skin cancer during their lifetime. So how many people are in this room? 15 at the most? 3 of us, just by statistics alone. Okay, so here's some photos. We're getting into photos now, so if you're squeamish at all, just beware. All of these are pictures of melanoma. The melanoma is one of the worst forms of skin cancer, and it's one of the worst forms because it can threaten human life. And it does that because it can metastasize, meaning it can start in the skin, but it can move to other parts of the body, like the lung, the liver, the brains. That's called metastasis, and melanoma can do that. If caught early and cut out, melanoma is absolutely survivable. If it is caught late, it is sometimes not survivable. So this is these 3 photos just go to show you what we call the ABCDEs of skin cancer. So asymmetric, a ragged border, maybe the circumference is enlarging or the diameter is getting bigger, and then the E is for evolution. So does anybody have any questions as to why these are alarming? This one here?
Yeah, is the reddish part also melanoma?
Yes. Yes.
See, I always worry about identifying, because I don't know what things look like.
Yeah.
So to me, if you told me, oh, it always is black, like tar, then I'd be okay, I could identify that.
Sometimes it isn't. Sometimes it's amelanotic, meaning it doesn't have pigment. Amelanotic melanoma is in the tiny minority of melanoma cases, but it is possible. And it's also possible, too, that this pink part started out pigmented, and then the pigment dropped out with the immune system recognition of the tumor, but the immune system couldn't keep up with the growth of the tumor. Okay. So, and I know it's hard. It's hard even for us as professionals, and luckily our organ is the skin and we can biopsy it readily. If we have a problem, we can numb up the skin and take a sample. It's not like Dr. Velarde's organ where you have to put the patient on a cath table to get inside to take a biopsy of what you need. It's easy for us to biopsy the skin, and we do it every single day, multiple times a day. Lots of times we can say that is or it isn't just by looking at it, and that's just through practice and examinations that we had to take to get to where we are. But there are days when we are stumped too, and so we do a biopsy. So, like I said, ultraviolet radiation is the #1 cause of skin cancer. And the World Health Organization's International Agency for Research on Cancer rated tanning beds in group #1 in terms of carcinogens. So this World Health Organization's subset will rank into different groups, known carcinogens. Group 1 is the most carcinogenic. Cigarettes and tanning beds are in group 1. So if you wouldn't smoke a cigarette, you shouldn't use a tanning bed. People who use the age of tanning beds before age 35 increase their risk of melanoma by 75%. That's a huge deal. And that's why tanning bed legislation is really hot right now in different parts of the country as to whether or not, a person under the age of 18 should be allowed to tan without their parents' consent. Should anybody under the age of 18 be allowed to use a tanning bed? All of these things are hot topic questions, and then it starts to get into people's freedom of choice. And so there's not an easy answer to this question. If you ask me, I know the answer in my heart. Nobody should ever use a tanning bed ever. But just even one episode of tanning bed use will increase the risk for melanoma. So who gets skin cancer? So let me start by saying all skin types and colors, but the people who are at most risk are those who are fair-skinned, with light-colored eyes, blonde or red hair, those who easily burn or freckle, people who have had sunburns as a kid, and anybody with a family history of skin cancer. But basically, I wanted to say nobody is immune. Okay, yes, there are some groups that are higher risk than others, but no one is immune from getting skin cancer. There are 3 main types of skin cancer: basal cell, squamous cell, and melanoma, and those are listed in their order of prevalence. So basal cell carcinoma comprises about 80% of all skin cancers, whereas squamous does about 16%, and melanoma is 4%. Melanoma, like I said, is that most dangerous form of skin cancer. Luckily, it's in the minority of cases, but it is more likely to threaten human life than basal or squamous cell. So it deserves it deserves respect for sure. Here are 2 more examples of melanoma. Again, this one, a lot of different mix of colors with irregular borders. This one here, sort of a black as night sort of color with a little bit of some papular, sort of looks like a growing component there. I would biopsy both of these if they walked into my clinic. And melanoma is a growing problem. The statistics, I know this is 6 years old. I wanted to update it, and it's about the same right now. Okay, so in 2017 was when the last data was available, so it's still about 1 in 50. But in the 1930s, 1 in 5,000 Americans were likely to develop melanoma, and in 2012 that number had risen to 1 in 50. We don't know exactly why that is, but we have some ideas, and that is American dress between the 1930s and 2012 is much different. People covered up more in the 1930s than they do in the new millennia. And tanning beds were invented, right? So melanoma accounts for 75% of all skin cancer deaths. So even though it's only 4% of all diagnoses of skin cancer, it's 75% of all skin cancer deaths. If you catch a melanoma early, the 5-year survival rate is 98%. That's very good, okay? But for metastatic melanoma, once it's moved from the skin to another part of the body, the 5-year survival rate is 17%. There are new systemic therapies in development with very promising results, but I want to say we do not have a cure for melanoma. The best thing we can do is prevent it and catch it early if it happens to a patient. So this is another form of skin cancer. This is squamous cell. Squamous cell is like a non-healing sore. So like a pimple or a bug bite that maybe you've had for more than 4 to 6 weeks, that needs to be looked at. That doesn't necessarily mean that it's just taking a while to heal. That could signify that it is a skin cancer. And this is the second most common form of skin cancer. It is a little bit more life-threatening than basal cell. Basal cell is a very bland and gentle form of skin cancer, if I can call it that. Squamous cell carcinoma can cause morbidity and mortality, not as much as melanoma, but it can. And the rate of progression to the regional lymph nodes is around 5%. And here's basal cell. Basal cell, this is the most common form of skin cancer. It looks kind of like the kind of pearly pink papule with a little bit of dilated vessels over the top. Again, 80% of all skin cancers are going to be basal cell. You have a higher likelihood of being struck by lightning twice than dying from basal cell in your lifetime. Okay, so the odds are very, very low. I have only ever seen somebody with metastatic basal cell carcinoma one time, and there was a whole host of other medical conditions underlying that predisposed that patient to getting it. So, including immunosuppression and neglect.
Is there a reason to resect it then, other than cosmetic?
So yes, it can be locally destructive. So you can leave it there and it will be very slow growing. Sometimes people have had a basal cell carcinoma spot for 3 or 5 years or even longer. If you resect it with Mohs micrographic surgery, if it's especially on the head or neck, the cure rate is 99%. That's a fantastic cure rate. And it will prevent it from getting any bigger or causing any more local destruction. And my picture, my somewhat disturbing picture, is an example as to why treating a skin cancer early is always a good idea as opposed to letting it go. So like I said, basal cell is the most common type of skin cancer, greater than 1 million new cases every year. There's lots of different forms, but that's kind of for the dermatologist and the dermatopathologist to work out. But like I said, if caught early and treated appropriately, there's a 99% cure rate and an incredibly low rate of metastasis. Here are more pictures of basal cell carcinoma. So the pearly pink papule, this one in the lower middle has a little bit of pigment mixed in. That can be concerning to some people for melanoma, and it absolutely needs to be biopsied, but I will tell you I see a lot of pigmented basal cell carcinoma, and the pigment doesn't necessarily escalate the severity. Okay, so this is the one I was talking about. So this is a woman with a non-melanoma skin cancer, so this was basal cell. Okay, we just talked about that, and Dr. Velarde asked, about the resection. You can sort of see here, do you see this kind of ill-defined border where it's kind of like raised in pink? Probably wasn't bothering the patient that much, probably wasn't causing a lot of symptoms, wasn't too obvious. I mean, it wasn't like having a horn sticking off the tip of the nose, but when it had to be resected, that's how much of her nose that she lost. So it's locally destructive. It's not particularly easy to put that much nose back together, and what has to be done a lot of times is a rotation flap down from the forehead onto the tip of the nose, which is not a particularly fun procedure to have or recover from, because it is a 2-stage flap, which means that flap of forehead skin is twisted down and sewn to the tip of your nose and left in place for 3 weeks. So you have this little elephant trunk of skin between your forehead and the tip of your nose. It is not particularly pleasant. So what about skin cancer and skin of color? I get that question a lot. We know that fair-skinned people are at a higher risk, but what about people who are of Hispanic or African American descent? The risk is less, but like I said, it is not 0, okay? No one is immune. So a 4 to 5% lifetime risk in Hispanics and a 1 to 2% lifetime risk in African Americans. I have diagnosed and resected basal cell carcinoma from the scalp of an African American man. And another thing I wanted to say is that darker pigmented populations, although they have a lower risk, have been consistently shown to have poorer outcomes because it is usually caught later due to the misconception that it's not going to happen to me, kind of a thing. So here are the ABCDEs of skin cancer, like we talked about. The A stands for asymmetry, the B stands for border, the C stands for color, diameter, and evolution. Basically what this all boils down to is if you have a spot that's changing or will not heal, it needs to be evaluated. It takes 5 minutes to do a skin biopsy in the office, and with a biopsy, we can tell you definitively if it is or if it isn't. So now let's talk a little bit about the prevention. So now that we're all good and scared about skin cancer, what can we do to make sure that it doesn't happen to us? So don't ever use a tanning bed. If you're using a tanning bed now, please stop. You don't have to raise your hand. I'm not going to call you out on it. I used tanning beds before I knew any better. I wish I could go back and change it, but I can't. And so, yeah, I used tanning beds multiple times before the age of 35 and definitely increased my risk for melanoma. Can't go back in time, but I can make sure that I don't do it going forward.
Can I interject there
Yes.
too? Because I have a lot of friends who still do this, but they'll go to the tanning beds to get a base color before they go on vacation. It's not a thing. So
It's not a
you're
thing.
yeah, you're exposing yourself to carcinogens. So, and then you go on vacation and still get sunburn. That previous tan that you got from the tanning bed is not your coverage. That's not your sunscreen.
Yeah, it's all risk, no benefit. So sunscreen, I get a lot of questions about sunscreen, like what do I recommend? I don't necessarily endorse any one particular brand. We can talk about like the U.S. News and World Consumer Reports on sunscreen every year, because they'll rank, their top 30 and their, you'll see which ones are the good ones and which ones are the bad ones. In all honesty, all that matters to me is that you're using SPF 30 or greater, that you're putting it on appropriately, and we'll talk about how to do that, and that you're reapplying it, okay? Protective clothing would be like a hat. It would be sunglasses. Don't forget about your eyes. It would be long sleeve shirts. It would be, long pants if you can tolerate it. And a lot of my patients say, wait, I live in Florida. I'm not walking outside in long sleeves and long pants and a hat. No, I'm gonna overheat. Well, they do make some UPF clothing that's very lightweight, and it even has like these sort of like mesh vents underneath the arms. You can buy them at Gulf stores and Bass Pro Shop, and even at like Walmart and Target now, where it's actually not as uncomfortable as you would think to wear long sleeves in the summer in Florida. And then regular self-skin exams, know your body, because sometimes when a patient comes in and shows me a spot, sometimes I ask, well, how long has it been there? Tell me about it. Does it itch? Is it growing? Is it changing? Have you always had it? Do you remember having this in high school? Tell me about it.
Can I ask a question
Yeah.
about protective clothing? There's this, stores are full of clothing now that claim to have some sort of chemical addition to the fabric. Can you talk about whether that is a real
It is a real thing, but there's a finite number of washes on it. And so just understand that there's a finite number of washes on that clothing if it's been treated with a chemical. Now, the flip side of that coin would be blue jeans are SPF 100. And that's only because of they're a thick, tightly woven fabric. And so you can wash those until there's a hole in it, and it's still going to be SPF 100 until there's a hole in it. But yeah, the ones that are chemically treated, or you can even buy chemicals to add into your washer that will treat the clothing that you already have. Apparently, I've never used it. But yeah, you can have treated clothing, but just look at the label and it'll say like good for up to X number of washes.
But how about a place where you can't really put a cover? Like, I always worry about my nose. Like, I wear a hat, I wear sunglasses, and I put sunscreen on, but I know my nose is big, and it's sticking out, and it's getting sun every single day. Is there anything you can recommend for those kinds of little areas that are hard to cover?
So sunscreen every day, even if it's rainy like today, even if there's a hurricane, just get in the habit of wearing a daily facial moisturizer with sunscreen, and then reapplying. Like if you're going to go for a walk over your lunch break and you're worried about the sun exposure on your nose, I would keep a little daily facial moisturizer SPF 30 in my purse and put a little bit on before I went out for a walk. Get the tops of your ears, wear a hat.